Now, we are actually already several weeks into Medicare Open Enrollment for 2018. Now, if you've been putting it off because it seems a little overwhelming for you, today we're going to help you with that. If you don't know what plans are available or even which one is right for you, Melanie Heffelman is here to guide you through all of this. Melanie, thank you so much for coming back.
Absolutely.
This is the perfect time for us to talk about this. I think it's in the pocket where people are thinking, I better get moving on this. But why is it so important that we tackle open enrollment?
Well, open enrollment runs from October 15th through December 7th each year, and it gives Medicare beneficiaries an opportunity to make changes to their plans. So if they've maybe had a change in their health status or maybe their financial status, this is the time of year where they want to evaluate that, check and see what plans are available for them, and see what fits their health needs best.
And so once we know, okay, we need to do this, here's that time period, what are some things that you advise on people on how to make that an easier choosing process? Because I think that's where everyone gets a little overwhelmed.
Yeah, absolutely. And the thing to remember with healthcare is it's not one size fits all. So there's a lot of plans available in the market. So think about what's most important to you. Is it your primary care physician that you want to stay with? Maybe it's a cardiologist or a specialist or a particular hospital that you want to be seen at. So making sure that all of the providers that you want to see are in your network within your plan so that you have that convenience of knowing that your health care is going to be taken care of.
So it starts with kind of checking in with yourself to what you need.
Absolutely.
Are there other tips that you can kind of give us in that choosing process?
Absolutely. So Medicare Advantage has actually become a really popular choice for people because it's simple. It lumps all of your health care into one simple plan. So you have your parts A and B, which are your traditional Medicare, and then it also lumps in your prescription drug coverage on most plans as well. It's one simple card, it's convenient, and it's easy to understand. And so we've seen about 50% increase in Medicare Advantage enrollments over the past 5 years, and that's with 10,000 people a day becoming eligible for Medicare.
Now, I was going to say, because each time you come to visit me, I feel like we have been talking about that. And then as, you know, the years come on, I feel like more and more people are starting to realize, hey, this is one, available, and two, that it does fit them and it's much easier, gets that kind of overwhelming feel out of the way. Now, even though we're seeing Advantage, you know, care is something that's available, something that's easier, having somebody kind of walk you through everything, because you says one size does not fit all. You have to kind of really look at your own individual needs. What are some resources where we can get some help?
So UnitedHealthcare has done a really great job in making ourselves available in the community. So our goal is really to help people understand that that choice is out there. So we have websites available. You can go to uhcmedicareplans.com to look at our specific plans that are available in the Tucson area. We also have MedicareMadeClear.com, which is a big one because sometimes you don't understand what is Medicare.
Yeah.
And so that's a really great resource as well. And then we also have a Medicare store here in Tucson that people can visit. It's on the northeast corner of Grant and Swan. We have actual agents in there that can answer your question, really help to support you and guide you through the process to make you feel comfortable in understanding that you're making the right choice for your health.
And I think that's really important to mention because I think a lot of people, you know, when they're thinking about their mailbox right now, jammed full of information, you kind of, it's probably sitting somewhere on your counter and you're like, yeah, I'm going to go through all of that. Yes, I'm going to get around to it. But having somebody face to face kind of eases that a little bit. And I love that we continue to talk about it in this, you know, aspect also because a lot of people can kind of learn a little bit along the way. I know you were kind of talking about Plan A, Plan B. Can you kind of break that down a little bit more for me?
Sure. So traditional Medicare is made up of parts A and B. So that's your hospital and your provider coverage. When you start thinking about C and D and all the other letters that come with it, D is going to be your prescription drug coverage. So traditional Medicare does not contain Part D. So when we add A plus B plus D, that's when we get Part C, which is the Medicare Advantage plan. So it kind of brings everything together for you into one nice little convenient package.
C kind of makes your alphabet soup all into
alphabet soup. You got
it. One. I think right now, and some people, like you said, either they need to make some changes. People are new to Medicare and just want to start from base one. No matter where you're kind of in that span, getting the education is the best thing for you.
Absolutely.
I'm going to wrap up one more time all of those resources that are available to them. But Melanie, thank you so much for coming in. This was the perfect time. Like I said, here's that recap of all the resources available to make the process of choosing a Medicare plan easier for all of us. For more information on UnitedHealthcare plans, visit uhcmedicareplans.com. You can also call them at 1-800-830-8536. To see a licensed agent in person, you can visit their store at Crossroads Festival on Grant Road. And to learn more on Medicare in general, visit MedicareMadeClear.com.